Did you know that by the time you finish this video, about 20 seniors will have been diagnosed with dementia? That's one new case every 66 seconds. But here's the scary part. What if the cause isn't aging, but something inside your medicine cabinet? You've been told these pills are safe, routine, even necessary. But new studies are raising alarms. Almost 99% of seniors have no clue that at least one of their medications could shrink vital memory centers in the brain by more than 28% in less than a year. Let that sink in. And the pharmaceutical industry has been aware of this for decades. Yet they continue making billions from selling drugs that may be speeding up cognitive decline in millions of seniors. In fact, a 2023 study in neurology and aging research revealed that one class of medications raised dementia risk by 49% in older adults within just 2 years of use. In this video, we're going to uncover the 9 most dangerous medications that trigger rapid memory loss and dementia, ranked from commonly overlooked to brain damaging. And number 3 is prescribed to millions for something minor, but it can shrink memory centers in your brain. And you probably have no idea it's happening. Before we get started, tell us in the comments what medications you take daily. Have you ever noticed sudden brain fog or forgetfulness? We're reading every single comment and giving personalized replies. Now let's get started. Number 9, diphenhydramine, also known as Benadryl. Diphenhydramine is that pink pill millions rely on for sleep, allergies, or cold symptoms. It's cheap, available over the counter, and chances are you have it in your drawer right now. You may think you're just using it for better sleep or allergy relief, but inside your brain, Benadryl could be interfering with the hippocampus, the area responsible for forming new memories. Benadryl belongs to a group of drugs called anticholinergics, which block a brain chemical called acetylcholine. This chemical is essential for forming new memories and staying mentally sharp. As we get older, the brain relies even more on what acetylcholine is left. When a drug disrupts that process, the results can be devastating. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who regularly used anticholinergic drugs faced a 54% higher risk of dementia compared to those who did not. So what can you do to protect your memory? The first step is to avoid anything with diphenhydramine, especially medications labeled PM, nighttime, or allergy relief, since many of them are just Benadryl under another name. If you're using diphenhydramine for allergies, there are newer non-sedating options like loratadine, better known as Claritin, which don't cross the blood-brain barrier and are much safer for seniors long-term. Never stop any medication suddenly, but also never assume over-the-counter means safe. Next is a medication that's marketed as gentle on the stomach, but it could be robbing your brain of nutrients it needs to stay sharp. Number 8, proton pump inhibitors. Prilosec and Nexium belong to a drug class called proton pump inhibitors, or PPIs. These are prescribed to reduce stomach acid and are commonly given for heartburn, acid reflux, and GERD. Many seniors stay on them for years or even decades because their symptoms return quickly when they stop. What's often ignored is how PPIs interfere with vitamin B12 absorption. B12 is essential for brain health, memory, focus, and stable mood. A 2016 study published in JAMA Neurology looked at over 73,000 people aged 75 and older. It found that regular PPI users had a 44% higher risk of dementia than non-users. By lowering stomach acid too much, PPIs also disrupt the body's ability to absorb magnesium and calcium, both needed for nerve signaling and brain communication. Without these, neurons struggle to fire properly, leading to confusion, misfiring, and memory problems that look a lot like early Alzheimer's. And it doesn't stop there. PPIs have been shown to raise amyloid beta plaque buildup in the brain, toxic proteins linked directly to Alzheimer's disease. The good news is there are safer paths. If you're on a PPI every day, ask your doctor about slowly tapering off with the help of H2 blockers like famotidine sold as Pepcid. While not perfect, H2 blockers are less likely to cause memory problems. You can also try natural options such as deglycyrrhezonated licorice, which coats the stomach lining and eases irritation without harming cognition. Up next is a drug prescribed for bladder control, but it could be damaging both short-term memory and emotional balance. Number 7, bladder control medications. Oxybutynin, sold as Ditropan, is commonly prescribed to seniors with urinary incontinence or overactive bladder. On the surface, it seems like a practical solution. Nobody wants to deal with constant bathroom trips. But oxybutynin works by blocking acetylcholine, the same brain chemical affected by Benadryl. Unlike milder anticholinergics, oxybutynin crosses the blood-brain barrier easily and directly impacts the hippocampus, the memory hub of the brain. That makes it especially dangerous for older adults who take it long-term. A 2019 study published in the BMJ showed that people over 65 who use strong medications like oxybutynin for more than a year faced a 49% greater risk of developing dementia. That's almost 1 in 2. The bigger concern is that many seniors are never told about these cognitive side effects. They're simply told it will help with bladder control, not that it could speed up mental decline. The damage often looks like normal aging. Patients describe brain fog, forgotten appointments, misplaced belongings, or difficulty keeping up with conversations. Rarely is it linked back to the medication until it's too late. So if you're on oxybutynin and you've noticed mental changes, it's not just aging. And you don't have to stay on this drug to stay in control. Thankfully, there are newer alternatives like mirabegron, sold as Myrbetriq, which work in a completely different way and have far less impact on memory. These drugs don't block acetylcholine and are usually much safer for seniors. Number 6, statins. Statins are some of the most commonly prescribed drugs worldwide, particularly for adults over 60. Their main purpose is to lower cholesterol levels and cut the chances of heart attacks and strokes. The 2 most frequently used ones are simvastatin and atorvastatin, sold under the brand names Zocor and Lipitor. But this is where the concern begins. Cholesterol is not only connected to heart health, it's also essential for the brain. Since the brain is made up of nearly 60% fat, cholesterol plays an important role in forming and maintaining the myelin sheath, the protective layer that allows nerve signals to travel efficiently. When cholesterol is reduced too aggressively, the brain may be deprived of what it needs to function well. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who had been taking statins for more than 3 years had a 26% greater risk of mild cognitive impairment. Those on higher doses showed even more noticeable decline. Even more worrying, some patients reported sudden memory lapses, describing situations where they couldn't remember names, recent conversations, or familiar driving routes. It's important to note, however, that not all statins have the same effect on the brain. Options like pravastatin and rosuvastatin don't cross the blood-brain barrier as easily, making them less likely to cause cognitive side effects. If you've been on a statin for years and noticed confusion, forgetfulness, or mental fog, it may be time to speak with your doctor about lowering your dose or exploring alternatives. Don't wait until the effects become permanent. The sooner you act, the better chance you have of protecting your memory for the future. Number 5, benzodiazepines. Benzodiazepines, drugs such as lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, are commonly prescribed for anxiety and sleep issues. They work by boosting GABA, a chemical in the brain that calms overactivity. In the beginning, these medications can feel like lifesavers. They quiet the mind, ease panic, and help people sleep. But with time, they can turn into something very different, a trap. A 2022 study in the BMJ followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The risk was even greater for long-acting versions like diazepam, which linger in the body and build up in fatty tissues, including the brain. The effect is essentially chemical sedation, slowing down neural activity. As a result, the brain becomes less adaptable, slower at learning, and more vulnerable to memory lapses, confusion, and emotional flatness. Many seniors on benzodiazepines say they feel disconnected, mentally clouded, or simply not like themselves. The biggest challenge comes when they try to quit. Withdrawal symptoms such as anxiety, restlessness, and insomnia can be intense, making it seem like they need the drug, even though the drug itself is creating the problem. The solution is not to stop suddenly, since that can be dangerous. Instead, work with a doctor to slowly reduce the dose. Safer alternatives include buspirone, a non-sedating medication for anxiety, or cognitive behavioral therapy for both anxiety and insomnia. These approaches can restore calm without harming memory. Number 4, amitriptyline, Elavil. Amitriptyline, sold under the brand name Elavil, is an older antidepressant still commonly prescribed for sleep problems, pain, and sometimes migraines. On the surface, it looks like a versatile medication, but in reality, it is one of the strongest anticholinergic drugs still in use. This means it blocks acetylcholine, the chemical that allows brain cells to communicate, form memories, and stay mentally sharp. The blocking effect is so powerful that long-term cognitive issues are not just possible, they are expected. A large 2015 study in JAMA Internal Medicine analysed more than 3,400 adults aged 65 and older. It found that people who took higher amounts of anticholinergic medications such as amitriptyline over a 10-year period had a 54% higher risk of developing dementia. That's not a minor increase, that's more than half again the normal risk. The worrying part is that many patients were never warned of the memory risks. They were often prescribed amitriptyline for nerve pain or sleep issues and only later noticed memory loss, difficulty finding words, and reduced concentration. And it doesn't take high doses to create problems. Even small doses taken regularly over years can cause a gradual erosion of brain function. The damage is silent, no early symptoms, just a slow decline that looks like aging but is actually drug-related. If you or someone you know is taking amitriptyline, ask your doctor about safer alternatives. For nerve pain, medications like duloxetine or gabapentin may help without the same cognitive risks. For sleep, melatonin or low-dose doxepin, which has a much milder anticholinergic effect, can be considered. For depression, newer antidepressants such as sertraline or escitalopram are usually safer for brain health. Number 3, paroxetine, Paxil. Paroxetine, sold under the name Paxil, is one of the most frequently prescribed SSRIs, selective serotonin reuptake inhibitors, for depression and anxiety. It's often seen as a modern option, supposedly gentler than older antidepressants. But here's what isn't widely known. Paroxetine is the only SSRI with strong anticholinergic effects, meaning it interferes with acetylcholine in the brain. That one factor makes it very different from other SSRIs like sertraline or escitalopram. A major 2021 review in Frontiers in Psychiatry examined elderly patients taking various SSRIs. It found that those on paroxetine had clear declines in short-term memory, verbal recall, and attention span within just 12 months. The same review showed that seniors on paroxetine were 30% more likely to develop early cognitive impairment than those on other antidepressants. The strange irony is that paroxetine is prescribed to stabilize mood, yet over time it reduces mental clarity and emotional stability. The solution here is clear. Paroxetine should be avoided in older adults. The American Geriatric Society has already included it in its Beers criteria list, which highlights drugs that are risky for seniors. If you're taking it, ask your doctor about safer alternatives such as sertraline or escitalopram, which don't carry the same cognitive dangers. Adding B vitamins, especially B6 and B12, can also provide natural mood support. Number 2, antipsychotics. This one is especially concerning because many seniors don't even realize they're on an antipsychotic. Medications like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally created to treat schizophrenia and bipolar disorder. But today, they're often prescribed off-label to older adults for sleep troubles, agitation, or behavioral changes tied to dementia. That's right, drugs meant for serious psychiatric conditions are being used in nursing homes and hospitals for seniors who are simply restless, confused, or difficult to manage. The results can be devastating. In 2022, a large study published in The Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors given antipsychotics for behavioral issues were 71% more likely to experience worsening cognitive decline within a year, even if they had no dementia history. On top of that, these drugs raise the risk of stroke, sudden death, and heavy sedation, which can trigger falls, hospital stays, or even permanent placement in long-term care. The way these drugs work explains why. Antipsychotics suppress dopamine, a brain chemical linked not only to mood and motivation, but also to memory and executive function. When dopamine levels drop, the brain slows down and becomes less responsive. This is why seniors on these drugs often seem dull, flat, or almost zombie-like. Their personalities fade away, leaving families grieving someone who is still physically alive. Fixing this starts with tough questions. If you or a loved one is on an antipsychotic, ask the doctor why it was prescribed and whether it's truly needed. In many cases, behavioral problems can be handled without drugs by setting up consistent routines, reducing noise, easing discomfort, improving lighting, and supporting better sleep habits. When medication is unavoidable, using the lowest dose for the shortest time possible can lower the risks. Unfortunately, these drugs are too often prescribed for convenience rather than medical necessity. The saddest part is that many families aren't told what these medications actually do. They just watch their loved one decline, never realizing the cause is chemical, not natural aging. Number 1, anticholinergic polypharmacy. This is the hidden threat few people ever discuss, and it's one of the biggest reasons behind drug-induced dementia in older adults. You might expect a single medication to hold the top spot, but the most dangerous factor for rapid dementia in seniors isn't one pill. It's the combined effect of taking multiple drugs with anticholinergic properties, a situation known as anticholinergic polypharmacy. Here's how it plays out. A senior takes diphenhydramine for sleep, oxybutynin for bladder problems, and amitriptyline for pain. On their own, each drug may cause only minor memory issues, but together they add up and the total anticholinergic burden climbs dangerously high. This isn't just theory. In 2022, researchers published in Age and Aging an analysis of more than 280,000 older adults and found that those with the highest anticholinergic burden faced a 120% higher risk of developing dementia within 10 years, more than double the normal risk. The most troubling part is that most seniors don't even know they're on anticholinergic drugs. When acetylcholine is blocked from several directions at once, the brain doesn't just slow down, it begins to deteriorate. Nerve cells shrink, synapses weaken, and the brain slips into a low-activity state that looks very much like Alzheimer's. Reversing this doesn't require a miracle, it requires a careful review of medications. Ask your doctor or pharmacist to look at your full list of prescriptions, over-the-counter medicines, and even supplements to check the anticholinergic load. There are professional tools and software that calculate the total burden. Once it's identified, the process of deprescribing can begin, slowly tapering off what isn't needed, switching to safer options, and restoring balance in the brain. This is the most hopeful part of the whole discussion. Drug-induced dementia can often be reversed. Once the burden is lowered, many seniors regain clarity, sharper memory, and more energy within weeks or months. The brain can recover, but only if you give it the chance. Polypharmacy is not only harmful, it's avoidable, and that makes it the #1 hidden medical threat to the minds of our aging population. Now, we'd like to hear from you. Are you currently on any of these medications? Have you noticed brain fog, forgetfulness, or personality changes since starting them? Would you be open to asking your doctor this week to review your medication list? Share your thoughts and stories in the comments below. We'd love to hear them. Thanks for watching.